This is Dr. Greg Hall once again with Better Black Health, brought to you by the Better Black Health book, which is on sale at most bookstores and doing extremely well, and talks about vaccines and supports them, as well as genetic sequence multivitamins, still the only multivitamins that best support the nutritional needs of African Americans. Today, I'm real pleased to welcome Michael Myers Jr., a Harvard, my goodness, and Johns Hopkins, my goodness, trained physician, former chief of primary care and chief of pediatrics for Summit Health in New Jersey, and the author of the Vaccine Bible. Boy, didn't we need a vaccine Bible, a comprehensive common sense guide to what keeps us safe from the flu, measles, hepatitis, and more. As vaccine-preventable diseases begin to resurface in communities across the country, Dr. Myers joins us to discuss why these illnesses, what they really look like, why outbreaks can affect more than just the unvaccinated, and how families, particularly Black families, can better support their families. It's been, I've got patients who are just against vaccines, and I love them. All right. So I say that I have patients that support people I don't support, but I love them too. Right. I like most of them. I just don't like that part of them that doesn't agree with me. But I do have patients that say, I don't want any vaccines. And I try to tell them that statement, it sounds crazier to us. I'm going to speak on your behalf, Dr. Myers,
right?
With the average person, because all vaccines were not created equal, were they?
Correct.
And so let's welcome Dr. Michael Myers.
Thank you so much, Greg, for having me as a guest. And with that opening and what you present there about one of your hesitant patients, I think what's really important, people make these categorical statements, right, is to maybe try to have them give you or give us, a reason or a specific incident, like something happened to cause this particular viewpoint. I think what happens these days is that people use platitudes and take positions, but really what this is about is a particular occurrence. So let's talk about what happened and then why you develop that strong belief you have about vaccines, and let's explore kind of like what went on there. It's as a doctor, as doctors we know, it's pretty much like taking a very good history of a problem. Like, we're not jumping to a conclusion, but we're kind of carefully walking the patient through the history of present illness and kind of like what happened and how did you develop the symptoms and what you came to present with today. So it's the same when people are so-called vaccine hesitant. Yeah.
Right. But I've got people that are grown that were probably vaccinated as a child when no one asked them anything.
Yeah.
But because of, I'm not sure anything ever happened to them. It's just because of this conspiracy environment that has been created that sometimes validates people who just don't like needles.
Yes.
I don't want a needle. And then so now somebody's saying that vaccines cause autism, for example.
Right.
It's one of those things. So help me out. Does vaccine cause autism?
No.
So there was no pause there. There was no pause.
It has been categorically proven that there is absolutely no cause of autism with any vaccine, particularly MMR, measles, mumps, rubella.
Right.
And there have been multiple studies since this really became a feature of our conversation, let's say in the late 1990s. There have been, studies across the world among millions of children that have siblings who have autism, all of whom who experience various vaccine events, including MMR. There has been no causal link at all. So your audience needs to understand that the drumbeat around this, I have a viewpoint of why this is occurring. There are people who are in positions of federal health policy who want to sow confusion and hesitation and distrust. But from a scientific evidence-based perspective of many, many studies over the last 30 years, there is no link between MMR, measles vaccine, and autism.
So, but there are side effects to
Yes,
vaccines, right?
that's
And
true.
like there's side effects to water. I tell
Right,
you can drink too
right.
much water, right? And so, what are the side effects that people are afraid of, and what's the risk? You know, if you see a thing for indigestion, a commercial for a medicine for indigestion on TV, they're going to mention diarrhea, constipation, and death, right, as a potential side effect, right? Or just for Prilosec, you know what I'm
There,
saying, right?
yeah,
And so
there's
there's
a
a
lot of
wide range.
small there's a lot of small print. So let's clear this thing up right now, right? In terms of adverse effects or side effects, it is not uncommon if you get a flu shot or a measles shot or a COVID-19 vaccine for the latest iteration of COVID, that you might have some local, pain or soreness. You might develop a low-grade fever. You might be tired. You might be sleepy. Sometimes these signs indicate that your immune system is actually developing an immune response to, we call these the antigens. The antigens are the active component of a vaccine. Antigen is a word that is short for antibody generator, antigen.
Mhm.
And essentially, when your body's introduced to a weakened part or some portion of a bacteria or a virus or the toxin that the bacteria might make, like say in the case of tetanus vaccine, it develops an immune response, antibodies and immune cells. And while it's doing that, it produces and throws off things that may cause fever or tiredness. All of those side effects are self-limited, don't cause any particular complications or long-term problems. One of the most serious things that can happen is something called anaphylaxis. Anaphylaxis is a very rare but serious um, allergic reaction, not just to vaccines, but you can have these kind of allergic reactions to peanuts or
Mhm.
strawberries or curry powder or whatever it is. There are lots of things that we're exposed to in our environment. That occurs in vaccines maybe one time among a million shots that are given, right? So
Mhm.
it's extremely rare. And in the United States, we have a variety of ways in which vaccine incidents are monitored. Your audience and other physicians may know something called VAERS, which is VAERS, an acronym that means the Vaccine Adverse Effects Reporting System. So
Mhm.
essentially, if you have some vaccine related incident or problem, you or your healthcare provider can report that to this website, which is run by the federal government. And that doesn't mean necessarily that the vaccine caused the thing that you necessarily are reporting,
Mhm.
but this is a database that collects this information. And then if that database begins to show a signal that things are beginning to happen with this particular vaccine, it will be studied. People need to understand too that vaccines are highly and carefully monitored by the Food and Drug Administration, okay? And that vaccines are issued a license. These are biological products that have to be given to healthy people. Okay, people aren't really sick. This
Mhm.
is meant to prevent sickness.
Right.
And so if there's ever any real serious problem, those issues are being monitored constantly. They're being studied. The FDA has pulled licenses, and pharmaceutical companies have taken vaccines off the market in response to those safety concerns. So yes, there are side effects of vaccines. Many of them are self-limited. The most serious one, anaphylaxis, maybe happens once in a million
Yeah.
times.
Yeah.
And then anything that we would be really, really concerning would be known to other people that are monitoring those signals.
And that makes good sense. And so the point is that you don't have to micromanage the safety of a vaccine. There's already people out there that are being paid real money
It's in place,
to
right?
micromanage the
Right.
safety of it,
Right.
and the risk for an adverse event versus the benefit is just tremendous, isn't it?
Absolutely. It is. And I think, Greg, the best example of that, unfortunately, is what is now going on with this measles outbreak that began in January 2025 in West Texas. Measles is an infectious illness caused by probably one of the most highly contagious viruses known to humankind, the measles virus. Essentially, if you have no protection from prior disease or vaccination, and you're in a room, with someone that has the measles, and they're like, I don't know, they came and left the room like 2 hours ago, right? Like a conference hall, you're 90% likely to get measles just from being in that room, and the person's already gone. That's how contagious it is.
That's crazy. That's
Right.
crazy. Yeah.
And what's been going on now in our country is this. I think of this current measles epidemic almost as an ongoing, smoldering forest fire. So
Mhm.
it began in West Texas. It has spread across the United States. We now, in 2026, have seen nearly 2,500 cases, which has now exceeded the total number in 2025. We're not even finished with 2026. Projections are that we may end up this year at 3,500 to 4,000 cases. This is more cases of measles than we have seen in the United States in over 30 years. And it is all happening in people that have not been vaccinated against the measles virus. Now, measles is not something you want to get. In the case of our current outbreak, 3 people have already died in 2025. Hundreds of people have been hospitalized, usually for pneumonia. If you get measles and survive, you're very likely to be left with permanent deafness, meningitis, or brain infection, and your own immune system is severely compromised, exposing you to other infections, throughout your entire life.
Right.
And once you get the illness of measles, there's nothing that we can do for you in the medical system. We can provide supportive care. We can give you fluids and watch your diet and monitor your vital signs, but there's no antibiotic for
Mhm.
measles once you have it. So this is why it is extremely, and we've been using the measles vaccine since 1963. This
Crazy.
is not something new. We've
Dude,
given
right.
billions of doses of this very safe and highly effective vaccine. It's 97% effective when both doses are given. We've been using this for over 60 years. So people need to realize the serious risk of walking around in the world today, particularly depending on where you live, what state, what county you're in, unvaccinated against measles, because
Right.
you're highly likely to get this illness and it's completely preventable.
And there's no way. That's amazing. That's such incredible information. And they used to line us up. I'm throwing you in with me and give us vaccines. And no one
Yes.
asked us. No one asked our parents. No one asked
Right.
anybody anything. And
Right.
it essentially wiped out measles.
Yes.
I mean,
Yes.
it was measles. Is nobody's thinking about measles. And I have older people, older paranoid people who will call me. Oh, they had a measles outbreak. I don't know whether I had a shot or not. You know what I mean? And they're
Yeah.
my
Yeah.
age or closer. I was like, yeah, you had a shot. But the first few people I checked their titers are outstanding. They had a
Yeah.
shot back in 1963 and 64.
Yeah.
They've got all kinds of immunity even after all this time. In fact, those original vaccines almost give better immunity than some of the newer ones. Or I don't want to say that, but it's amazing that no one's had any waning immunity because of
Right.
time. Your immune
Correct.
system remembers all that.
It
And the
does.
people who are trying to be smarter than the rest of the world and say, I'm not going to vaccinate my kids are really putting their kids at risk.
Well, you're speaking to, again, I feel this way. I'm very passionate. I wrote a book about it, but vaccines are, to me, among the greatest achievements of humankind, maybe with space flight
Mhm.
and something else. But in any way, um, what vaccines do as a technology is they work with your immune system, which is itself pretty incredible and complicated. To me, also second to the central nervous system as the most important thing that has prolonged the life and life expectancy of our species. I mean,
Mhm.
our immune systems.
Mhm.
But our immune systems are smart, and what vaccines do is train and teach our immune systems to recognize and to remember, right, that measles germ for life.
Hmm.
Those cells, those memory cells right now are sitting in your bone marrow, and they're sitting in your lymph nodes and your spleen of your body. And should that virus come back, they are called out of, into active duty, like, into the National Guard. And
Hmm.
they're out there in the bloodstream kind of doing their thing to keep you safe. And that's why you don't experience it. Two other things I want to say about the example that you just presented. Even the measles vaccine, as effective as it is only 97% effective, right? So there are going to be periodically people that develop this and so-called were immunized against measles. And the other thing is, we're talking about measles, but there are, again, with, let's say, influenza or COVID-19, you could have been vaccinated for those respiratory illnesses, but then you might actually get COVID, or you might actually get a case of the seasonal flu.
Hmm.
These are examples of where vaccines aren't necessarily created to prevent you from getting a disease. They are tested and created to prevent you from dying or having more serious outcomes from the disease, right? So people that have chronic conditions like diabetes or heart disease or congestive heart failure, if they have not been immunized against COVID-19, and they end up getting, let's say they're older, and they end up getting SARS-CoV-2, they're very likely to have a worse experience and probably die from this illness.
Hmm.
People that with that same profile who have been immunized against COVID-19 might get COVID-19 and, like, go to bed, feel bad, have a headache, but they're not going to be hospitalized and they're not going to die. That is what the studies initially showed when the vaccine was tested and licensed by the FDA. It doesn't prevent you from getting the illness, it's preventing you from dying and being hospitalized from the illness. So I think that distinction is very important for people to keep in mind.
That's important. Why do we have to get one every year, or why isn't one like I had my measles or two back when I was little, and I haven't had any since? Why with the influenza, for example, do I have to
Yeah.
get one every year?
So let's talk about influenza virus, and let's talk about SARS-CoV-2 virus, which causes COVID-19. So with influenza, the reason you have to get a seasonal flu shot, starting maybe even now, like late August through, probably to March, is because the virus itself every year changes genetically. It mutates, it changes its form to evade your immune system so it can continue to populate. And what we do is, in the northern hemisphere of the world, we follow, because our seasons are different than the southern hemisphere. So we follow the outbreaks of flu in Australia, New Zealand, and southern parts of the planet. And then we look at what is circulating as influenza virus. And then pharmaceutical companies then take that information and they develop a best guess at what the likely components of a virus will be in the northern hemisphere during our flu season. Influenza is a disease that tends to spread during the colder months of the year. So sometime, from like the fall, winter into the early spring. So that's how influenza is formulated and why we have to get a seasonal flu shot. We used to think the same thing applied for SARS-CoV-2. Now our knowledge is that it's not necessarily related to seasonal. What is because the SARS-CoV-2 virus itself continues to mutate throughout the year,
Hmm.
and you can actually get it at any point. And so what's really more important is understanding. That's why the CDC and others talk about staying up to date and current with your COVID-19 vaccines. You need to understand how many of these vaccines you've gotten historically. What were the formulations? Was it the Pfizer? Was it the Johnson & Johnson? Was it Moderna?
Hmm.
And then what's going on right now with the SARS-CoV-2 virus? Because what you got may have protected you already from the current form of the circulating SARS-CoV-2 virus. Because it does mutate, it does change, but not as rapidly, and it doesn't become as potent or virulent as the influenza vaccine does every fall or winter. So that's the thing. We're getting seasonal flu shots, and we're more or less following and getting what we need to get for SARS-CoV-2, depending on our prior immunization status and kind of what's going on with the virus in the world. Does
Right.
that answer your question?
It does, and I've tried to explain to people, but sometimes it can be a sticking point. So that's why we learn
Hmm.
these things. How much shifting back to where we are with the CDC and the Health and Human Services with the current administration. Everyone's saying, "Oh, the sky's falling." They've done irreparable damage to public health. Um, have they done irreparable damages to public health?
I don't know if it's irreparable. I think there has been damage done. I think what's happened, in fact, this week on Monday, August the 10th, 2026, President Trump issued, I think, his 273rd executive order in this administration called, and I want to be clear about the language here. It is called the Delivering Gold Standard Childhood Vaccine Recommendations for Americans. It is, you're chuckling. There's nothing gold standard about this at all. And in fact, let me start with that. Okay. They laid out what the principles of gold standard science are, and then proceeded not to even follow those in issuing this executive orders. Gold standard science to them means it needs to be transparent, reproducible, free of conflicts of interest, scientifically studied, evidentiary. Those are the principles. None of this applies to what was issued on Monday. In fact, there's a lot to unpack with this particular executive order, and I'm going to start with the most glaring. They specifically call out the measles, mumps, rubella vaccine, which is a combination vaccine. In other words, when you get that one shot in your arm, and most children will get this, it's a 2-shot vaccine that's given between 12 and 15 months and 4 to 6 years. And what you just said earlier, if you get those 2 series of shots in that framework, you'll be protected for life, your entire life. There are no boosters that are needed. Nothing needs to be done. Okay. They said that their preference is that people get these vaccines as standalone single vaccinations at multiple medical visits without offering any medical evidence or scientific evidence. Now let me say a couple of things about this. First of all, today in the United States and the world, there are no standalone measles, mumps, rubella vaccines. There aren't. And the 2 companies that make MMR, Merck and GSK, came out the day after this was issued and said, basically, we have no intention to develop standalone vaccines. These vaccines are safe and effective as a combination. Were licensed by the FDA in the 60s and 70s to meet those standards. Okay. And there's no business case for it, to be honest. And it would take 10 years for us to actually develop standalone vaccines at a time when we have an ongoing measles outbreak that is the worst we've experienced in our country in over 30 years. So this executive order from the federal health policy leaders, Robert Kennedy Jr., the President of the United States, is completely nonsensical. It makes no sense, cannot be operationalized. Private industry is not even going to do anything about this. They say they want you to offer these when they become, quote unquote, domestically available. Well, they're not going to become domestically available because the people going to make them aren't going to make them. It's just like not going to happen. So,
But why? And you can say I don't know.
no, I have a theory.
Why do they want? Why would they do that?
So here's my theory. Okay. In general, we have a sinking economy and a war that makes no sense. So I see a lot of this stuff as a distraction from a
Mm-hmm.
larger conversation
Mm-hmm.
and worry that people have in the real world. The price of gas, can't afford health care, can't buy a house, all of that. And now we're in a war where it's going to get worse in terms of gas prices, maybe even safety because all the bombs and drones are being used up. Okay, that's one part of it. The other part is that Kennedy has no business in this job as Secretary of Health and Human Services. He is a known anti-vaccine skeptic. He's written books and articles about this. He is set on a mission. I don't know where this comes from, to first of all link measles, mumps, rubella vaccine to autism, where there is no linkage, as I said before, to disparage vaccines generally, to actually increase mistrust and hesitation and hesitancy in the American public. I don't know why he feels this way. I don't know what motivates these actions, but these are the consequences. And you know what's also interesting? The executive order specifically calls out MMR as a
Mm-hmm.
combination vaccine. There are other combination vaccines. There's diphtheria, tetanus, pertussis. There's
Mm-hmm.
a vaccine called Vaxelis, which basically protects you against 6 different germs in one shot. 6 germs in one shot. Okay. None of those were basically called out. Only MMR was specifically stood up to say, we want that to be a standalone vaccine with 3. Why? Why that alone? And where is the science? And the
Right.
manufacturers are saying the same thing. There's no evidence that there's any benefit, and we're not going to study this again because it's settled. So I really don't understand how or why they do what they do, except to say, well, let's look at the results. It's distracted us from talking about, the price of gas, and it furthers Kennedy's cause to induce more hesitation and skepticism about vaccines in the American public. So mission accomplished on their end, because that's exactly what they've done.
Yeah, no, it definitely, there's definitely more hesitance I see in my practice, but I see that. So, but earlier I started by saying, all vaccinations weren't created equal, in the sense that I get a flu shot every year and it doesn't do anything to me, right? I got the shingles vaccine, and I woke up
Ah,
with chills, the night of the thing, and I got some Tylenol, and I woke up in the morning and I felt fine. But I did have chills or sweats, with that. COVID, I have to take the day off. If I get a
right,
COVID
right.
vaccine, that next day I need to be off. But it's better than being in the hospital in the ICU,
That is true.
which I've been. So it's like when you say I don't want a vaccine, you're saying like I don't want chemotherapy, which I laugh at people. There's a different chemotherapy for every different cancer. You don't
Correct.
throw all chemotherapies out the window. You don't throw all vaccines out the window. You don't throw all medications out, because when you get sick with COVID, hell, they want everything then. I want prednisone. I want the latest thing. I want everything now, right?
Right.
Going to be consistent. You would not want the vaccine or any treatments for the for the
One of the things to keep in mind too is that vaccines have done such a good job at ridding the world of paralytic polio, or people dying from diphtheria,
mm,
or the conversations. I mean, before the vaccine became available in the 1960s, thousands of people developed measles and hundreds of people died from this terrible illness. So what happens now in our world, where we don't see iron lungs, we've eradicated smallpox,
mm,
measles is kind of making its case now, coming around various states, is that these very, like, I don't want to say small adverse effects, but when people start having, side effects or various complaints, those become more prominent, and somehow they're seen as a problem, when what's not really known, or the lived experience was never part of lived experience, is being an iron lung or not able to walk, or the fear people used to have in the 50s in the summer from getting polio. I mean, things like that, or the fact that your kid has whooping cough or diphtheria and could die of a sore throat. I mean, that's the kind of world that we used to live in before vaccines.
one of the unintended consequences, I hope, of having so much turmoil at the top of our government is that we are going to start educating ourselves through people that
Mm,
we trust and that we vet. And one thing, Black people have never abandoned Black doctors, right? They
hmm
if they find a Black doctor they like and trust, they ask their opinion, and they will take it above the CDC or whoever's out there. And so that's why I think it's so important for every family to have the vaccine Bible, a comprehensive common sense guide to what keeps us safe from the flu, measles, hepatitis. Man, we didn't even talk about hepatitis and more. What drove you to write a book like that? This last half hour has been about what drove you to do it, but why wasn't there something like that out there? And how, every family should have this book, right?
Yeah. Well, thank you, because I think every family should have the book as well. And I wrote it for that very reason. I wrote it for a general audience with no science background who, may be skeptic or very confused about what vaccines really are. Because in this space of vaccine books that you can get from Amazon or Barnes and Noble, there was really nothing like this, right? If you go into a store now, you'll see books, sort of for and against vaccines, almost like these political arguments. But people just want, like, I call it in the book, the Fannie Farmer Cookbook of Vaccines. So they want a basic recipe for
Just
how
the
to make
facts,
cornbread.
man, right? Like the police
Right.
officer. Just the facts, ma'am, right?
Just right, yeah. How do I make buttermilk biscuits? I don't know.
Yeah.
That's all that, and that's in the book in a section called the Vax Facts, where you can literally, from anthrax to Zika, you can look up Ebola, rabies, influenza, whatever it is, and in 4 or 5 pages, I give you everything you need to know about the germ, the disease that causes it, the vaccine made against it, the cultural context of both the disease and the vaccine. So I give you a lot of information. So when you have a conversation with your family or your friends or your colleagues, or you go to your healthcare provider, you can have an opinion, but at least have an informed opinion based upon, some terms and some concepts. So that's why I wrote the book. I wanted people to be armed with knowledge, right? And I wanted them to have in their hands, because you can look a lot of this stuff up on the web if you want. You're going to spend a lot of time and be very confused. Even with ChatGPT, if you try to get ChatGPT to help you, you'll be a little bit confused.
Right.
I'm of a certain age. I'm a boomer, and I believe in books and
Mhm.
having an old school thing you can hold in your hands and sort of, pull out and look at and kind of, underline and look things up. And that's why I wrote the book, to provide that resource that people could trust. I had the best education on the solar system, and I have no vested interest in any of this except to keep you safe and to give you information. That's all. That's it.
The world a better place. That's
Right.
so
Doesn't
outstanding.
that sound corny? Like, just to
Well,
make
it
the world a
does, but
better place.
that's what we do. And what I've said in my book, Better Black Health, was the concept behind the vaccination was brought to the New World, to America, by Onesimus.
That's right.
Cotton
The
Manor. So it's like
smallpox.
all African.
Yes.
This is our African heritage. This is our African
Absolutely.
families.
I want to say
brought
Cotton Mather and Onesimus. Yeah.
Right.
Right.
But he was a slave with Cotton Mather. He brought it to Cotton Mather. This is like,
Right.
Colonel Sanders and KFC. Do you
Yeah.
really think Colonel Sanders came up with that recipe?
That recipe.
That's a
Well,
different
and all
episode.
that went down here in Boston.
It's
where
a
I'm
different
from.
episode, but
Yeah.
that it's in our genes to be advanced and to be at the forefront of health. First
Correct.
doctor, right? Imhotep. So you write in the Vaccine Bible, Dr. Michael Myers, really just an outstanding contribution to our families, to America, and we appreciate having you.
And they can find it at www.drmikemyers.com, MIKEMYERS, drmikemyers.com, or go to Amazon, Barnes and Noble, Bookshop. It's all available there right now.
Right, very good. And we've been trying to not send people to Jeff Bezos. No,
well, I know. That's why I said.
But that's where people are comfortable, and I unfortunately I keep him rich as well, buying stuff I don't want to go to the store and get. But yes,
Right.
Absolutely, find the Vaccine Bible and get one for your home. It would make a great Christmas gift. Things coming
Yes.
up when you try to give the gift of health. If you have skeptical kids, this is something to give them a chance to sit on
Good
the
for
table
you.
and help them to think about what decisions they make, and not just how they feel or what they hear on TV, but what they read from a reliable person who's trying to make the world a better place. Thanks.
Absolutely. Thank you so
Myers,
much
for joining us. We appreciate it so much.
My pleasure. Thank you, Greg, for having me.
None of the statements that I have made have been evaluated by the Food and Drug Administration. Genetic sequence multivitamins are not intended to treat, cure, or prevent any diseases. Furthermore, none of my statements should be construed as dispensing medical advice or making claims regarding the cure or prevention of diseases. You should consult your own licensed healthcare provider before starting any supplement, diet change, or exercise program, especially if you're pregnant or have pre-existing injuries or medical conditions. Remember, having a doctor is always your best option.